read to at home are more likely to know the entire alphabet, to write their own names, and even be able to read compared to kids who are not read to. They're even more likely to be better at math, according to the National Center for Education Statistics.
And Dr. Sonia Dominguez is a physician at St. Vincent's Family Medicine Center, knows this, and has led the charge in the health system's participation in a program that incorporates books into pediatric care and encourages families to read out loud together. Take a look.
As a family physician and associate director of the St. Vincent's Family Medicine Residency Program, Dr. Sonia Dominguez knows literacy plays a huge role in child development. That's why she started the St. Vincent's chapter of the Reach Out and Read program in 2003. Since then, more than 15,000 free books have been passed out to kids in our community through the program. Now, Dr. Dominguez is expanding her efforts with a lending library and high-tech book nooks inside the St. Vincent's Family Medicine Center.
This is available anytime anyone is waiting to be seen. We have a large digital library here, so books for any age range. Several of them are interactive. I'll show you one of those. The nice thing is that we can have this project, so children can be playing with different games, but one of them will connect. In addition to this, we also have the lending library, so if they find a book, a paper book that they're enjoying during their visit, they can take that with them. They can take it home, and then they can bring other books that they've enjoyed through the program so that other kids can enjoy them as well. The smile is, worth 1,000 words. And what it is, children now don't dread coming to the office. Even if it's not their appointment, they know that they'll be entertained, especially the ones that have been here before and have seen what we have available to them. So, they can entertain themselves, and like I said, when it's time for their parent to be called or for them to be called, they don't have to stop what they're doing. They can take a book back to the waiting room with them, and it's theirs. If they want to keep it, they can take it home. Sometimes they just want to look at it, and they'll bring it back and return it so another child can enjoy. And I think it's also teaching them that, you can donate books to others, just because you have some books that you're finished with and you've outgrown, you can bring those back for other children to enjoy. So there's a lot of different things going on. I mean, you've got one, just the entertainment of making a visit to the doctor's office more enjoyable. You have the learning environment and the interaction that happens between parents, other children. They're learning to share time on the iPads, and then they're learning the importance of being a good community member and bringing more books to donate.
And Dr. Sonia Dominguez is joining us now. This is fantastic. I mean, it's so great that St. Vincent's is just embracing your idea. So how did the book nooks, how did this idea of yours come about?
The book nook came about, actually it's inspired and borrowed from a digital library in San Antonio, Texas that we visited called Bibliotech. And for their county, the entire library is digital. People check out iPads and they can look at these books and take them home. And I thought, this is fantastic. And nowadays it seems like kids are born knowing how to work these devices better than their parents. And so why don't we, rather than say don't use that, let's embrace the technology and have them use, board books, regular books, and then move that into the iPads.
Wow. Well, what people might be wondering, like you said, St. Vincent's is doing this, but why doctors? Why in doctors' offices?
Right, that's a great question. And what's interesting is that, especially as family physicians, pediatricians, we're really the first people that come in contact to families with small children. And so they may not know that it is important to have books at a very early age. They may be upset that a child will put a book in their mouth, but actually when they're about 6 months, that's how babies explore their world. So that's normal. And so we can give this anticipatory guidance at their well visits and explain how important it is to bond over books.
So how does literacy or illiteracy really affect the health of a child? How is this playing a role?
Yeah, I mean, it really is a global issue. And so, there's a lot of wonderful literacy initiatives going on, but the earlier you start, the better. By the time a child gets to kindergarten, if they really don't know what books are and how they work, they're at a severe disadvantage. And so when you introduce the books early, not only do they grow up bonding with their parents and later loving books, love reading, they get it. They can sit there in their classes, they can be confident, they're not behind the eight ball.
It's the confidence, right? Because it's old hat. They've had experience with it, whether it's putting it in their mouth at 6 months or having a chance to read with mom and dad. That's great.
We don't have a ton of time left. Just books versus paper books versus the digital versus the pad. Is there a difference? Does it matter? Or just get them reading?
Get them reading. Both of them are very important. We use the books as a tool. We can kind of see what their fine motor and their gross motor skills are. We can catch things like reading disabilities early. But the digital, I mean, this is the digital world, and we have to embrace that. And that's really going to be a part of how kids learn. And so incorporating both is fantastic.
Dr. Dominguez, thank you so much for being here and for what you're doing. It's fantastic. And we appreciate St. Vincent's HealthCare, of course, for coming on and making all of this happen. And you can learn more about what they have to offer on jackshealth.com.
Well, these twins